Can COVID is an open science collective dedicated to rapidly mobilizing and sharing knowledge to help inform Canada's COVID-19 response. To learn more about us or how to join our community, you can visit our website at cancovid.ca.
Get started. Hello, everyone, and welcome to this week's edition of Can COVID Speaker Series. Thanks so much for joining us today, and happy International Women's Day. My name is Rosa Stalteri, and I lead the Knowledge Translation team at Can COVID, and I'm also the moderator for today's session. And I have the pleasure of introducing you to this week's speakers. First, we have Dr. Olga Bougie, who is the Assistant Professor at Queen's University, specializing in minimally invasive gynecologic surgery at the Department of Obstetrics and Gynecology at Kingston General Hospital. And we also have Dr. Innie Chen, who is the Associate Professor and Clinical Research Chair at the Department of Obstetrics and Gynecology at the University of Ottawa. She's also a scientist at the Ottawa Hospital Research Institute within the minimally invasive and also a minimally invasive gynecologic surgeon at the Ottawa Hospital. And our title for today is Women's Issues in Pandemic Times, How COVID-19 Has Exacerbated Gender Inequalities for Women in Canada and around the world. And we're so excited to be able to have this topic on this special day. So without further ado, I will hand over the floor to Dr. Bougie and Dr. Chen.
Thank you so much for the very warm and kind introduction. We really want to thank Can COVID for the amazing work that you do, and also for the opportunity to come and speak on a topic that we feel is very important and a great way to spend today. Just trying to see if I can advance. We would like to begin by acknowledging that Ottawa is part of the territory taken under the Crawford Purchase and the traditional land of the Anishinaabe, the Mohawk, and is located on the unceded territory of the Algonquin Anishinaabe people. So Dr. Bougie and I both have academic roles within our university and our hospital. However, today we are speaking to everyone from our experience as frontline physician workers and as physicians and surgeons for women's health conditions. And it's really this on the ground experience and our interaction with patients that have really prompted us to share our ideas with everyone. And in addition, there were at the time lots and lots of reports in the media of what was going on. So that coupled with our own experiences as mothers and as members within our family really enabled us to have a glimpse of what many women may be facing around the world, and prompted us to write an article for our national specialty organization on how women's issues and women's health have been affected based on our observations through our own lived experiences and our patients. So in honor and celebration of International Women's Day, we are so pleased and honored to be here to share with you our perspective on how the pandemic has affected women's health. And we also wish to acknowledge that in celebrating women, we include individuals born with XX chromosome and also individuals who identify as women. The presentation is limited, though, in that there isn't that much information on gender diverse individuals, but we do feel that gender diverse individuals have also been disproportionately affected.
Wonderful. Thank you very much, Innie. And again, I echo thank you to Can COVID for inviting us to give this presentation. So today we really hope to examine the various biopsychosocial domains that have been disproportionately adversely impacted by COVID-19, specifically looking at the inequality portion for women. Again, described based on our own background, both as clinicians as well as researchers, the disproportionate adverse impact of COVID-19 on women's health and healthcare access, and then to propose some strategies as we shift out of the pandemic or, get used to living in this endemic of COVID-19, of how we can alleviate the challenges and barriers that women are facing in terms of healthcare access. Next slide. So one thing we want to propose, and this is a bit of an obvious slide, but certainly there are a number of benefits of gender equality, and that's why we're striving for that as a society, both within Canada and globally, gender equality. And we know that countries or societies that promote greater gender equalities are beneficial in terms of fairness. These societies tend to promote greater economic or display greater economic prosperity, health, happiness, peace, and security. And certainly I would imagine that we're all striving for these virtues in today's world. Next slide. So what did we see in terms of the impact of COVID-19 on women? Right at the beginning from the pandemic, so this is taking us back now two years ago in 2020, we saw that employment rates fell by a greater percentage for women compared to men. As we were facing some recovery in terms of economics, we saw that unemployment rates were slower to recover for women than men. And even moving forward now to the latest Omicron closures in Ontario, where we saw again shutdowns, again, the job losses were reflected and were greater in the same populations, including women as well as youth. Sorry, you can go ahead. There are a number of factors of why women were traditionally more impacted in terms of the employment sector. One of this is that women traditionally work in service-oriented industries. So we know a substantial number of women were in healthcare and social resources. A greater percentage of women we see in educational resources, as well as accommodations and food services. We know that another huge impact of COVID-19 on women was the disproportionate uptake of childcare, senior care, and assistance with domestic duties, as well as meal preparation. So women were losing their places in the workplace, but those that were remaining in the workplace were also having to juggle a number of different responsibilities. Even looking at our population, that's probably closer to the group that we're discussing today, women in academic roles were noted to have a substantial decrease in manuscripts, academic productivity, and peer-reviewed articles. And this was from the when we compare the 2 years prior to the pandemic to following the pandemic. So certainly this is concerning and can have repercussions that are downstream for individuals that lose academic productivity looking forward in their career. I think it's important to acknowledge that although Canada is one of the countries that has greater gender equity, that the gender gap already existed as displayed in the 2017 Statistics Canada report, that women perform fewer hours of paid work on average than men, and are more likely to work part-time, which is one of the reasons that they were disproportionately impacted by the closures and the economic issues in the COVID-19 pandemic, as well as we know that in many sectors, including the healthcare sector, where Dr. Chen and I work, that women are more likely to earn less for similar jobs that are performed. Go ahead.
Sorry. Good.
Yeah.
So one area that we really want to focus on is health impacts as well, because that's what Dr. Bougie and I see more frontline. Early in the pandemic, we did a scoping review of basically women's health and equity, and 4 themes emerged from this preliminary review, which was women were differentially affected in terms of COVID infections, mental health, gender-based violence, and healthcare access. I think the data on COVID infections is fairly well known. In general, women, because of their front-facing jobs generally, tend to have higher rates of COVID infection, but men appear to be more affected in terms of severe disease. However, one group of women that are disproportionately affected are pregnant women, and we see here that there are much higher rates of percent of pregnant women needing hospitalization and admission to ICU. And these are patients that we see in our office, so we are very careful with our pregnant women, and for this reason, pregnant women are identified to be one of the high-risk conditions for COVID in our. Unfortunately, pregnant women also have a lot of vaccine hesitancy, and certain groups across the country, such as at our hospital, are trying to delve into this a bit more. But certainly, this is an area needing further research. In addition, because of the various factors of some of these psychosocial impacts that Dr. Bougie was mentioning, the isolation, increasing social isolation, decreased transport and such, there has been an increase in gender-based violence, not just in Canada, but globally. Sorry. Having some difficulty with slide advancement here. There you go. All of these psychosocial and biological stresses have definitely impacted women's mental health as well, disproportionately. So whereas a mental health gap existed between men and women before the pandemic, this has been further exacerbated, and the negative effect is thought to be mostly driven by the decline in women's mental health. I do want to point that the gap with gender diverse individuals is even larger. So I wanted to acknowledge that that this is an area also needing further study. Healthcare access is an area that we have really viscerally experienced. So there's been wide disruption in clinical services due to various factors. On top of that, because of finances and transportation, women may not always be able to access healthcare as needed. On top of that, they may have to take time off work, or they may require relief of caregiving responsibilities. So all of this together to suggest to add to the picture of healthcare access being a real issue. One area that was of high concern was access to contraception. And you know, this is a survey study by the Guttmacher Institute, showing that in the US, many women reported wanting to delay pregnancy. However, they have experienced cancellation or access barriers to contraceptive care. And on top of that, the affordability of contraceptive care was an issue more than before the pandemic. And they compared the pandemic to being worse than the 2008 recession. Similar barriers to access to contraceptive care were noted in Canada and also other countries like Peru and such. However, on the other side of the spectrum, while many women wanted to delay childbearing, for many women, fertility care, where it's also a very time-sensitive area of healthcare, was very much restricted as well. You know, these so we're painting a picture of basically healthcare being affected across the spectrum of women's lives, including you know, care effects on older women as well, where there are published reports on the increase in suffering and negative experiences of women with gynecologic cancer and also breast cancer as well. One area that is also severely impacted has been for healthcare for gender diverse individuals. There is during the pandemic, there was a real shift towards emergency acute care, and you know, these gender affirming care was deprioritized. So we see in the news and also in the published literature evidence of this as well. We get a lot of questions about how the vaccine affects menstruation, and there may be some small changes due to the vaccination, but more research is needed. However, even before the pandemic, Dr. Bougie and I understand from the experiences of our patients and our work that the issue of menstruation requires a lot more attention and study. So just because there's a pandemic, women still get their cycles. And in fact, they're very commonly overlooked, with a third of women experiencing menstrual bleeding disorder, a fifth of women having menstrual pain, and with fibroids and endometriosis being very common conditions. Pain in particular is, pelvic pain and menstrual pain in particular is quite a neglected morbidity. Women are disproportionately affected, often because they experience menses, penetrative intercourse, pregnancy, childbirth, more prone to urinary tract infections, which creates a point of disparity. And unfortunately, studies have shown when they try to access care for this, they are more likely to be dismissed and denied pain medication.
Thanks. So I think Dr. Chen has already pointed out, you know, a number of issues that were significant even before the pandemic. What the pandemic has really exacerbated is, you know, gynecologic and women's care on a number of fronts. So there's limited access to diagnosis, which is usually through primary care. Many primary care physicians have shifted to more virtual clinics to assess patients. And that has certainly made it challenging for women to gain access, to get appropriate screening, and to get referrals. There's limitations to gynecologic consultations to see us. And then many of the conditions that we treat do require surgical treatment, which has been really significantly impacted in the pandemic, as well as medical options, again, may be cost prohibitive. You can advance the slide, Innie. Thanks. As we mentioned, the surgery slowdown has had a significant impact, and that's not unique to women, but in particular gynecological care, because many of the conditions are not cancer, have been significantly deprioritized. Right now, Ontario is estimating that there's over 500,000 surgeries that were not, you know, delayed because of the pandemic. You can see here the surgical closures with each wave of COVID exacerbation. And obviously that's very, very challenging to catch up. So, you know, from a personal experience, I'll say that, you know, we keep delaying patients. My average wait list now is over a year. And as we mentioned, you know, these are women that are really significantly suffering. Many of them are primary caregivers. Ontario has had like the most school closures in North America. It's been very challenging for our population. Many of our patients have actually lost their jobs, partly exacerbated by the COVID pandemic, but also because of their gynecological issues. And we have been really limited in the care that we've been able, or the surgical access to care that we've been able to provide for patients. And then every time we get a little bit more surgical access, often the patients with benign conditions are again deprioritized, because in the interim, there have been more urgent pre-cancer or cancer conditions in patients that have gone on the wait list. You can advance the slide, Innie. So again, a huge number of surgeries delayed. So about 150,000 in Ontario and over 500,000 in Canada. And then we have to think about all the other services that have been delayed. So diagnostic imaging, as well as other testing. We can advance the slide. And again, we're seeing, we're really trying our best and obviously prioritizing gynecologic oncology. They've had their own issues. Again, it is partly exacerbated by access to primary care and delayed screening. Part of that is also patients have had significant anxiety. Dr. Chen has touched on the mental health impact. And because we're getting so many different, messages, many patients are really anxious to present to seek medical attention and have been dismissing, either routine screening or early signs of conditions that may be concerned, both from that may or may not be malignant, but certainly we've been very much prioritizing oncology and those type of surgeries, but that does come at a cost of benign gynecologic care, unfortunately. So today on International Women's Day, we'd like to think about some solutions moving forward. I think first and foremost, advocacy again is hugely important, and especially today, we want to make sure that we are increasing the awareness and prioritization for patients. We need more funding, we need more resources. It's appropriate that we speak on this topic today. Actually, March is also Endometriosis Awareness Month, which is a very common benign gynecologic conditions that both Dr. Chen and I specialize on. That typically the most common symptom is menstrual pain. I'm doing another talk on endometriosis today. And this is a really great example of advocacy, as a number of Toronto MPs have actually advocated for this condition. They've been able to make March officially Endometriosis Awareness Month, and are now lobbying the Ford government to have a care plan provided so that we get equitable diagnosis and treatment for patients that are suffering and impacted by the condition, that they get access to appropriate and timely surgery, and also that we increase the education regarding this condition. Go ahead. We want to improve medical care, so that may include care provider to prescribe medications, whether it be primary care, nurse practitioners, or having other interdisciplinary partnerships available to provide care for patients. Certainly a number of the gynecologic conditions that we treat, both including pain, but as well as other symptoms, require that interprofessional partnership with physiotherapy, with massage therapy, with other health professionals. We talked about cost being prohibitive, although we live, we always think of being in a universal coverage system. Certainly if patients are not able to afford medications, that can make it quite challenging. And as we already pointed out, many of the patients that we serve, specifically women, are more likely to be in part-time employment, and they may not have appropriate drug coverage. So that's another sort of advocacy piece that we want to address. We talked about virtual care, and I think we've all, I guess I can't speak to, but many of us have experienced it. Dr. Chen and I have experienced it significantly, as many of our in-person clinics were shifted. Certainly there is very much a role for virtual care, and it has been a huge savior in the pandemic, but I think we need to now really research the efficacy and how we can deliver virtual care in an appropriate manner. Many of our patients do necessitate an exam just by virtue of the services that we present. So we want to figure out the best way that we can provide virtual care sort of in collaboration with in-person visits when accessible by patients, and when those visits would improve their care. We, one piece of this is surgical care, but, as Dr. Chen and I are both surgeons, it's a huge piece for us. So as we mentioned, the huge surgical backlog is not an issue that we can add money to, and there's really limited funds, right, in the healthcare system. So we really need to find creative solutions to this. One solution for this, and this is from the Ottawa Hospital where Dr. Chen and I have both worked, is many of our gynecologic surgeries actually can be shifted out of the operating room and done in these outpatient treatment suites. There is a limited access to these right now, both in Ontario and across Canada, but they have been shown to, significantly reduce the surgical burden and provide effective care for a number of different procedures. So hysteroscopy is a surgery where we assess the cavity of the uterus. There's a number of treatment options that we can provide for patients with uterine fibroids, as well as endometrial ablation, which is a minimally invasive surgical technique that's an alternative to hysterectomy for certain gynecologic conditions.
So Dr. Bougie talked about some innovative ways of shifting care outside of the clinic and OR setting. And for women who do require care within the hospital, there's been a few innovative strategies to look at decreasing length of stay in hospital and hopefully be able to provide care to more people. So Dr. Bougie and I studied we observed increasing use of minimally invasive gynecologic surgery, which is associated with decreased length of stay and improved recovery, and this has been seen across Canada. And then as well, there is a lot of innovation in post-operative recovery and ensuring more comfortable care, prioritizing patient comfort and experience, which has enabled also earlier discharge and recovery, and more recently the use of virtual technology to help with post-operative monitoring at home as well. And our institution has been very active in studying and promoting these technologies. Dr. Bougie, would you like to make the concluding remarks?
Great. Thanks very much. So again, thank you again for listening in on today's presentation. We hope we've shown you that the COVID-19 pandemic has exacerbated a number of inequalities for women that already existed prior to the pandemic, both across the social, cultural, and economic factors that are intimately tied to women's health, well-being, and contribution to society. Women may be differentially impacted by restricted healthcare access due to susceptibilities based on reproductive conditions, including unintended pregnancies, as well as diseases of other reproductive organs. And we hope that we've introduced some potential solutions moving forward on how we can grow out of this pandemic and come out resilient, making sure that we're addressing women's health issues and allowing them to prosper within society. Thank you so much for listening.
Thank you so much, Dr. Bougie and Dr. Chen, for such an amazing talk. And we do have some great questions in the chat box, including some that are probably important, but better directed to family doctors so that they can provide personalized guidance. So I'll direct just the general ones here for our speakers now, and we'll go to the first question. So our first question here is, Dr. Chen, you touched on a number of domains affecting women, such as health and employment and gender-based violence. It seems a lot of the big issues are also women's issues. What would you say is the most urgent aspect to address? What should we prioritize?
I agree completely that these have always been women's issues, and the pattern that we're consistently seeing is the inequities that were seen before the pandemic are further exacerbated. It's really hard to know what to put priority on. From Dr. Bougie's and I perspective, we are physicians and care for the reproductive age group with the menstrual disorders. So of course, that's our point of advocacy. However, I think advocacy for women in general, outside of necessarily seeing women as merely organs, but seeing the global biopsychosocial role of women within society is the key to moving forward together.
Thank you so much. And just going back to some of the earlier questions, do both of you or one of you have any general advice for women considering returning to work? Anything that you recommend?
Can you maybe give us a little bit of perspective on what you mean by returning to work, like from a safety point of view, or
yeah, maybe things they can consider, or yeah, just something in general. If you have any, if you don't, that's fine. We can just move on to the next questions.
Both Dr. Bougie and I have 3 children and have experienced return to work many times following our parental leaves. And my only advice from a personal experience is just to be forgiving of yourself and kind to yourself. We expect so much of ourselves, right? We don't actually have 10 arms, just 2.
But thank you to the person in the chat that touched on my noisy child in the background.
Life demonstration.
Yes,
exactly. Our next question here is, how can health care providers help address the sex and or gender inequalities exacerbated in their patients due to the pandemic?
Yeah, so thank you so much. I think that's a great question. I think we're all coming to work each day doing our best. And I think just being aware and educating yourself that there are potentially inequalities, addressing your patients, asking them what responsibilities they're juggling, or what they think are specific challenges or unique challenges for them in the pandemic. We discuss things like access to medical care, access to healthcare in general, whether they would prefer a virtual appointment or an in-person appointment. Do they have caregiver responsibilities or burden, or if they've been impacted by job loss, addressing the mental health aspect, any of the things that we talked about. But I think it starts with, just taking a minute to realize that bias, and then doing your best to ask your patients on how you can address it.
Dr. Chen, would you like to add anything to that?
No, I think that was what I had in mind. Perfect.
We'll go on to the next questions. We are just a couple minutes over, so we'll get maybe 1 or 2 additional questions in. Mm-hmm. So you mentioned endo and increase in services for this condition, mm-hmm. But does this also include similar conditions such as adenomyosis, as endo is just one of many conditions that impact people with a uterus?
Mm-hmm.
Yeah, well, I guess in the interest of time, absolutely. Endometriosis and adenomyosis are very close. And, Dr. Chen and I both see and address a number of benign gynecological conditions and, try to advocate for them. So absolutely.
Mm-hmm. There is a kind of menstrual disorders is a larger group of conditions that can really debilitate women, and endometriosis, adenomyosis belong to that group. Compared to a couple generations ago, when menstruation was very taboo, I think we've come a long way, but there's still a lot longer ways to go.
Perfect. And we'll just sneak one more question in here is, please expand on the IPV violence rates and how the impact of COVID has been tracked.
I think Olga or Dr. Bougie did identify UN report on this topic, looking at it, trying to gather global data on this. But unfortunately, the data consists of cases that do surface. So there has, for example, in Canada, increased use of shelters, but of course, that's the tip of the iceberg, right? So
the increase has been estimated to be at about 30% or more increased rates due to a number of the factors that we discussed.
Perfect. Well, there are many great questions in the chat box, and perhaps Dr. Bougie and Dr. Chen, if anyone has any further questions, they can perhaps email you, you both.
Absolutely.
Perfect. Well, I just want to say and close the meeting and thank on behalf of the Can COVID team. Thank you for such a great talk, and we want to just say thanks to you both, Dr. Bougie and Dr. Chen, for the time that you took to present to us, and also for sharing this important talk on this important day for us women. And I just want to say that please join us at our next speaker series, which is March 15th from 3 to 3:30. So it's next Tuesday. And it's going to be on long-term care staffing and COVID, presented by Dr. Carol Esterbergs. And this does conclude today's event. Thank you so much for joining us, and we hope you have a great rest of your day.
thank you so much.
Thanks very much.
We would like to thank our speakers and members of our network for their continued support and participation in Canada's pandemic response. If you are interested in learning more about Can COVID or joining our Pan-Canadian COVID-19 Research Network, please visit our website at www.cancovid.ca.